In this video, I'm going to talk to you about how you can fix disc problems in the lower back at home, so down in this section here. Now, before I get into that, make sure you hit the subscribe button so you get notifications of our future videos and stay up to date with all the content that we're putting out on a daily and weekly basis around lower back, neck, and generally how to stay fit, healthy, and well. So, without further ado, disc problems are something that we see in the clinic here all the time, and hopefully in this video I can go through a few things that you can do at home, specifically to help your discs and right things, so you're not doing the wrong things. And if you do those correctly over time, really the discs should heal nicely. Our body's healing all the time, so with the right advice and with the right things and avoiding the wrong things, your discs really should heal. It's only the cases where there's something a little bit more complex going on that actually stops that disc from healing effectively, and that's where we come in as a clinic and we help patients with specific treatment, which I'll get into a little bit later. So first and foremost, actually understanding what is the role of this section down here in your lower back. The discs really are the little cushions between the bones in your spine, and those absorb the majority of the weight as your body is weight bearing every day in gravity. And because of some of the things that we're doing on a daily basis, you'll find that sitting for long periods, taxi rides, bus rides, in particular with the road bumps that are in major cities nowadays, can cause all sorts of trouble in the lower back, let alone lifting incorrectly in the gym. And when you injure these little shock absorbers in this disc, it can really cause an awful lot of trouble, not least because the small area right behind there is where the nerves exit, and this can commonly lead to things like sciatica if you get inflammation with these sorts of disc problems, and that can give you tremendous pain down the leg. So really, when things do go wrong with these discs, it can be really problematic, and a lot of patients will go to their GP, you get given exercises or get put on a waiting list to have some exercises in a couple of months' time. And that will lead you probably onto YouTube and see videos like this to try and get some guidance. Now, there's a few things that you shouldn't be doing. First and foremost, just lying on the floor doing nothing for days on end is not a good idea. It's out-of-date advice, it doesn't work. And even we have patients who call us up and say, they're looking for a new appointment, and they say, I've been on the floor for the last 6 weeks, I can't get up. And actually, I don't know how I'll make it to the clinic, and say, well, look, you ain't getting any better on the floor at home, come into the clinic. And when they get to the clinic, you know what, that little bit of activity made me feel a little bit better. They might still come in on crutches, but they feel a touch better, because movement is really important to these discs. They don't have the best blood supply, so when they get injured, if you just stay still, you can't get that motion, that movement to pump good products back into and around that disc and get rid of some of the inflammation and waste products. Everything just seizes up, which leads me to the next point of muscle spasm. Now, quite often these disc problems, as you might know, they're misdiagnosed in the early stages as, your back's just in a bit of muscle spasm. Here, take these anti-spasmodic drugs or muscle relaxants and everything will be okay, or have a massage and everything will be okay. But yes, the muscles going into spasm and contracting down through here creates a further problem, but it's not really the main problem. So just treating the muscle instead of actually this problem is a problem in of itself. Now, that brings me on to the stretches that patients are given. Now, quite often they're given exercises to hug the knees, etc., forward bending exercises, maybe some limbering up exercises, bending to touch your toes. But if you leave all of those out, avoid that forward bending motion, you'll notice the spine has a nice smooth curve to it. That curve is designed to absorb shock, and that curve is designed to not quite put so much pressure on the disc. Yet leaning forwards increases the pressure on that injured disc. So by abstaining from that forward leaning, forward bending activities, you're going to do a lot better in the medium to long term and in the short day-to-day term. So avoiding those exercises is really important. We always recommend to patients here to pop ice on the lower back. Now, it's not going to give you an immediate impact, an immediate benefit. It might do, but that's not the purpose. Popping ice on and off here for 3 to 5 minutes, a couple times a day, or as often as you can, periodically, not all in one go. 5 minutes, a break, 5 minutes later, a break, 5 minutes later. Just helps control the excess inflammation down here, and that's really, really important. So doing the ice as well as avoiding the forward bending, that's the two things for you to do at home. The final one is you can watch a video of this on our YouTube channel somewhere. Just type in lumbar disc stretch on our YouTube channel and you'll find the video. But this is a great stretch to just restore some of the curve in that spine. And what you'll notice when I take the spine off here, when we flex down, we close these disc spaces down the front, but when we bend backwards and open it out, you can see them opening up on the front, and that creates a negative pressure inside these discs, and that helps If you think of them like a balloon, if you squash down the balloon, it gets fat. When you stretch it, it gets skinny again, and that takes direct pressure off these discs, and that's a really good one. So you lie on your back over that rolled up towel, and that just gently takes pressure off these discs, combined with avoiding the bad things that I've already mentioned, so the forward bending, combined with a little bit of icing on that lower back to help the inflammation, and just being active, not lying down like I mentioned at the start of this video. Being active, moving around, walking, nothing extreme. Cycling, no, because you're bending forwards, but just a little bit of gentle walking within comfortable limits will actually really be the thing that makes a big difference in the short to medium term. And if you follow those tips sooner, before back pain and these sorts of disky problems get out of control, really you can get a good handle on it, then get yourself back in the gym doing some good solid exercise with a bit of guidance. And if you need any guidance with that, then we've got information on our Back in Shape app, which you might have heard about on our website, so just check that out, just to know you're doing the right exercises, but then work to strengthen things up in the future. And look, if it's really struggling and you're not getting any relief over a couple of days to a couple of weeks, after that sort of 2 or 3 week period, it's always best to just contact someone. Reach out to a practitioner if you're in the London area, or even just outside. You can always contact us and we'll do our best to get you in and actually get your body healing with treatments that actually target these discs to really force them to heal well, directly take some pressure off with things like the IUD therapy that we have here, help with the healing in the lower back with therapies like the laser therapy, and directly work on those muscles and joints with our IQ adjusting and the vibration therapy on these muscles. So if you do, worst case scenario, need some help, get in contact with us and we can always help, and you can do that by clicking the link somewhere on our YouTube channel, or maybe in the description of this video as you're watching it, or just heading over to the mayfairclinic.com. But hope you found this video helpful. Just to recap, stay active, don't lie down. Do the icing on your lower back, 5 minutes or so at any one time, but repeatedly through the day. Make sure you avoid forward bending and motions that may move in this direction to close those disc spaces. And then finally use that rolled up towel. Lie over your back with the rolled up towel, the lumbar disc stretch, which you can see on our website or on the YouTube channel, to open out those disc spaces. And if things don't get better, you get in contact with us and we'll be able to help you. Thanks for watching, hope you found it useful.